using the same metric, so in this case, the general measure of anxiety and the general measure of depression, in people who also had a rather specific measure of their PTSD or their social anxiety, their OCD and the panic. And you can see the differences are phenomenal. Although the treatments seem to be largely the same, we're getting much better outcomes when the therapist's behavior is guided by these more specific measures. And you can see for several of the conditions, we're way up in the 60% recovery, whereas it was sort of 45, 50 before. And in PTSD, the difference is really large, from 32% to 53%. So how come? What's the sort of magic that's going on there that these specific measures are producing much better outcomes? Well, you see on the right-hand side of the slide, part of the answer is that actually, if your therapist is using the specific measures, they give you on average somewhat more sessions of therapy, presumably because they're spotting that some of these specific symptoms haven't fully resolved themselves, even if you're saying you're feeling a lot better and you're worrying a lot less. But it isn't just that the dose of therapy is greater. If we statistically control for differences in therapy dose, we still find a big difference in outcome. So basically, every hour of therapy is more effective if it's guided by these more precise measures. So this is why we're pretty confident that we can move the overall outcomes of our services from 50% recovery to 60% or so by increasing the dose and making sure we're measuring the right thing to guide therapy.